Welcome to Mindfully Integrative Podcast with your host, Dr. Damaris G. Mindfully Integrative is a podcast discussing ways toward mindfully incorporating integrative health into our lives. This podcast will have informative resources, fun topics, interviews, and discussions relatable for today with a true mindful perspective in a mind-body, holistic life approach.
Hi, how are you? This is Dr. Damaris Maria Grossman, and I was talking about Breast Cancer Awareness Month. It's a very important topic, and it's very important for us to discuss in the sense of getting screenings, understanding and prevention, and understanding maybe even genetic markers. And the screenings can start even as early in the puberty stage, and knowing what your breast health is, breast health and care, even for men and for women. Men can also get breast cancer. So let's just talk about factors. So factors, initial risk factors that you can't change, right? That's female, usually older, but not definite, because I've had a family member that was before the age of 20 had breast cancer. You would have the cancer mutation gene, the BRCA1 or BRCA2. There's also cancer mutation genes of ATM and PLB2, TP53, CHEK2, and SK11. Now, there is possibly a family history, your race and ethnicity, some ethnic, African American, Hispanic, and Native American and Asian, and over the age of 40 are usually more predominantly considered. Dense breast tissue is a factor, but not always. Just because you have breast dense tissue does not mean you will have a predominant breast cancer. You could just have benign condition. And then there's other fibroids and other health issues that may be inclusive. And on top of that, it depends upon what else has been going on in your history. There is also those that have had nodules, carcinoma in suit. So that gives people some probability or sometimes infections in the breast tissue. Now, sometimes even just general exposures. Those are things that you may not have control over. Now, lifestyle factors that you do have control over are drinking too much alcohol, being overweight or obese. They can trigger menopause during menopausal states, and will also be a hindrance in the colony or bringing up a good terrain in the body, so that these cancer cells don't recreate or mutate. Not being physically active, not having children, not breastfeeding. Birth control is a factor. Hormonal therapy can be a factor for some individuals. And breast implants also have been shown to a greater increase for those for breast cancer. Now, not everything is proven to fix or no, but some also individuals that smoke or are getting less sleep or less melatonin or sun exposure. There's not enough research on that area, but has been told that those are factors from the research just in general with cancer. It's the factors come down to building the proper terrain within the body to not trigger some of these genetic markers or those mutations. So I'm here just kind of discussing breast cancer awareness and how important it is to do screenings even as early as puberty, to understand your breasts, understand how they're developing, and if there's changes at earliest that you find will be the best indication, identification, so that you can get treatment and further needs. So if you have any questions, please, of course, reach out. I also have one podcast, and in the month of October, many interviews of breast cancer survivors and cancer survivors talking about their journey and their things that they did to help them through. So take a listen to the Mindfully Integrative show in October, because we'll have many upcoming interviews of those surviving from breast cancer or a type of cancer in their life and readjusting and doing different modalities to help themselves heal. Check it out. And as I say, make sure you find a mindful way each and every day. Have a blessed day.
Thank you for listening to the Mindfully Integrative Show with Dr. Damaris Maria Grossman, family nurse practitioner. This podcast is for informational and educational purposes only and is not to substitute for professional medical advice, diagnose, or treat. Always consult your healthcare provider before making changes to your healthcare routine. Make sure to subscribe so you don't miss an episode. If you enjoyed our show, please support us by leaving a mindful review on Apple Podcasts or your favorite streaming platform. Interested in being a guest or more information? Email us at info@mindfullyintegrative.com. For resources mentioned in the show, visit our website at www.mindfullyintegrative.com. You can also connect mindfully with Dr. Damaris on her social media links found on the site. May your strength and peace guide you to find a mindful way every day. Namaste.